Hello, hello. Welcome, everyone. Hi, I'm Ayana Jones. I'm the IB Mentorship 365 Program Manager for IDSA Foundation. I want to thank you all for joining us today for presenting pathogens, crafting compelling presentations in ID. This is the kickoff of our ID Mentorship 365 webinar series, so we're excited. And special thanks to our speaker, Dr. Bares, who we will introduce shortly. Um, Before I turn over the program to our moderator, I have a few housekeeping matters. This webinar is being recorded and will be available on demand if you can't stay for the entire presentation. The presentation will be uploaded to Cooper, or you can access it and share it via our website and IDSA YouTube channel. You'll notice that your microphones are muted, but feel free to use the Q&A feature to ask questions during the event. There will be a dedicated Q&A session at the end of the presentation where you can unmute yourself. If we can't get all the questions during the live event, we'll do our best to address them in the following email, the follow-up email. Finally, as you know, we're on social media at IDSA Foundation across all platforms. So feel free to post any of your takeaways, any thoughts, anything from the webinar, and just tag us using our hashtag IDM365. So with that, I will introduce our host and moderator for today, our very own Dr. Amari Pearson Fields. Dr. Pearson Fields is a public health practitioner with more than 25 years of experience in program planning, implementation, and community engagement, capacity building, and training. Currently, she serves as the director of programs at the IDSA, where she provides oversight for the ID Mentorship 365 program, grants for the Emerging Research in Medicine program, our Alzheimer's program, our ID STEP program, IDA incubator programs, among others. So prior to joining IDSA, she led leadership roles within government, nonprofit, for-profit, and healthcare organizations, including serving as the division chief for cancer control programs at the DC Department of Health. She also served as executive director for the Capital Beast Care Center and the vice president of, Breast Care Center, and the vice president of programs of the breast care at Breast Care for Washington. Additionally, she has served as principal investigator on multiple national studies exploring cancer screening and behavior and access to healthcare services for women. So I will pass it to Dr. Amari Pearson Fields.
Hello, thank you all for joining us. And I kind of like the Beast Care Center. It reminds me of that children's book. Thank you, Ayana, for the introduction. I am beyond thrilled to initiate our first webinar in the ID Mentorship 365 series. Thank you all for joining us today. Next slide, please. As a reminder, our speaker will discuss best practices in delivering engaging, tailored presentation for diverse audiences in infectious diseases. You all should leave this webinar with an understanding of the importance of clear, concise communication of complex ID concepts, valuable strategies for enhancing public speaking, and practical resources that you can use to improve your presentations today. Next slide, please. It's my pleasure to introduce Dr. Sara Bares. Dr. Bares is an associate professor in the Division of Infectious Diseases at the University of Nebraska Medical Center. After receiving her undergraduate degree from Amherst College, Dr. Bares obtained her MD from Mount Sinai School of Medicine in New York City. She trained in internal medicine at the University of Chicago, where she was an intern, resident, and chief resident. Following her residency, Dr. Bares stayed on at the University of Chicago to complete a fellowship in infectious diseases. An accomplished clinician, educator, and researcher, she cares for patients with HIV and other infections, teaches students in all levels of their medical training, and conducts clinical research. In the past few years, Dr. Bares has coordinated local and national responses to multiple epidemics, including HIV, COVID-19, and Mpox. She has also organized and provided outreach to Omaha's Hispanic communities in need of Spanish language health news and education. Dr. Bares has received numerous awards for her work, including the 2022 HIV Medical Association Awards. So we are very pleased to welcome Dr. Bares this afternoon.
Thank you so much for the kind introduction. I'm honored to be here. We can go ahead and get started with the slides. These are my disclosures, and they're not related to the work that I'll be presenting today. Next slide. So we're going to be talking today about how to deliver and create presentations within the field of ID, and there are a lot of different kinds of presentations that you'll be giving. I think one of the most important things for your audiences is to know who is giving the presentation that they're hearing. And so that, we all at in different settings, you'll have presentations. I was just introduced today. It was a lovely introduction. It's a very formal introduction. And so I think there are many settings in which it's useful to add another sentence or two about yourself to really convey to the audience what brings you in as a speaker, what your expertise is, how you acquired that expertise, and also maybe why you're passionate about the subject that you're talking about. I think it's especially useful when you're giving a job talk, if you're giving lectures to medical students or trainees. They want to know sort of what you do outside of the lecture hall that gives you the knowledge and expertise to be presenting to them. You can make it a short introduction and choose a few things that are relevant to the audience and to the topic. So for example, I was just introduced today. It was a really excellent introduction and overview of who I am and what I do. I think the things that I could add to that are maybe useful for those of you listening to this talk today are that I used to be nervous about giving presentations, and I still am in a lot of different settings, and that's okay, and that's really common. I was born in Mexico, and so my first language was Spanish. My first language was not English, and so I grew up as a very, with an accent when I was younger that got made fun of because I moved to the States when I was only 3, and so I was very shy all through elementary school and high school and college, and I hated getting up in front of a room and talking to an audience. I would do everything possible to have a non-speaking role. So even when we had a class play that everyone had to participate, I learned to dance because I didn't have to talk if I could dance on stage. And now I'm a lot more comfortable giving talks. I stand in front of students in a lecture hall regularly, and my mom, I think, is especially probably the most wowed that I can stand in front of 100 students and not be nervous at all, but there are still a lot of settings in which I get nervous. And so that's okay. And what I've learned is the best way to not get nervous is to practice, but we'll talk about that later. Next slide. The probably most important thing that you can do when preparing presentations is to know your audience. I think we've probably all been in situations where we've been in the audience and feeling like the speaker really had no idea what our background knowledge is, what our interests were, and then you quickly disengage from the presentation because you realize you're not going to gain anything from that presentation. And so if you're on the other side, if you're the speaker, it's our responsibility to really understand who we're speaking to and what that audience wants from the presentation that you're going to be giving. I know it's sometimes, next slide, pretty easy to have an understanding. So in some cases, you can ask in advance. You can ask whoever invited you to give the talk, who is going to be present at the talk that I'm giving. If it's part of a course, I think it's really useful to, the course director may assign you a specific topic, but there's always going to be overlap. And so it's important to know what else is going to be taught that semester or during that course so that you can know if your material is going to overlap. And sometimes that's okay. Sometimes we tell students that this is planned redundancy. You need to hear things multiple times to really learn it. But other times you will immediately lose their attention because they say, I just heard that talk yesterday. This is useless information to me. If you don't have the chance to ask about the audience in advance, you can do so in real time. And so I asked our organizers today a little bit about the audience and who's here, but since we do have the chat function, I would love to know if you can just type in quickly while I'm talking what your background is, if you're a medical student, resident, fellow, or faculty, and which presentations make you, just include that, and then tell me which presentations make you the most nervous or which presentations do you find the most difficult to put together. If you don't have a Zoom function where you can poll the audience in real time, sometimes when I'm in front of a lecture hall, I just ask the audience by a show of hands, how many of you are MD students? How many of you are pharmacy students? How many of you are, you can try to get a little bit of a background. I'll sometimes say, how many of you have prior training in microbiology when I'm teaching to the first year medical students, because I've learned that a lot of them will have actually majored in microbiology. So it's really useful to have an understanding of who your audience is so that you can target your presentation appropriately. Perfect. Thanks so much to those of you who have put responses into the chat. And I will concur. I think sometimes the most difficult presentations for me are the targeted ones. And probably the most difficult ones for me are when you have a multidisciplinary audience. And so when I'm lecturing to both to people, we put on an annual HIV update conference. And even though that's my field of expertise, and I could probably give some of those talks in my sleep, I find it really challenging when I'm giving a talk that includes high-level HIV experts and then multidisciplinary people who are community workers or social workers who don't have the same medical knowledge, but have a lot of knowledge in other areas that I don't have. And so figuring out how to hone the presentation so that what you're presenting is engaging to everyone can be really challenging. Okay, perfect. Thank you all so much. Next slide. I think this is an important concept, not just for any scientific presentation that you're going to give, but for any manuscript or presentation. It's really important to use inclusive and non-stigmatizing language. The language that we as a presenter or the author or the scientific researcher use has the power to either empower our study participants, the study population that we care for, or stigmatize. And you can do so in the first slide of your presentation. And so you can quickly alienate your audience, or you can disempower those who you're really trying to lift up. So really important to be conscientious of this. I think the field of ID in general is really aware of this and has been working really hard across platforms to make a concerted effort to do so. I am fortunate to work with Paul Sachs on the editorial board of clinical infectious diseases, and he's been an incredible champion for this, and so much so that he empowered me to write a viewpoint last year with him and some of our other colleagues who are experts in this area, and really just as a call to action to everyone in our field to remember this. And I'll note before really delving deeper into the weeds that this is an area that's constantly evolving. And so I will say that although I have some suggestions for how to use inclusive and non-stigmatizing language. We all make mistakes. I cringe at some of the articles that I published from a few years ago that have language that is now outdated and not inclusive, and I cringe, but I also forgive myself because, again, it's an evolving field. And I would say that if you're ever in doubt, ask colleagues, and most importantly, ask the patient population that you're reporting on. And so I'm really lucky, I think, in the field of ID that, and especially probably the field of HIV, which is on the forefront of much of this, where many of our research involves community participants that have been informing us along the way of what language is appropriate, what language feels empowering, and which language alienates and stigmatizes people. And what we've learned over the years is that person-first language is really important and is ideal. We're all people first, not a disease. And so remember that when you're doing every form of presentation, whether it's presenting on the wards, or in the clinic, if you're presenting a case to a faculty member or a senior trainee, or if you're writing a manuscript, or if you're presenting orally. We are people with HIV, not the HIV infected person. We are people with COVID, not the COVID-19 patient on our floor. So remember, we're always people first, and try to, if you just remember that, that's a good rule of thumb for keeping the language inclusive. When you're reporting on race and ethnicity, there's a really useful resource is the AMA Manual of Style, there's a link to that at the bottom of this slide. If you ever have questions about how best to report on race and ethnicity, you can go to the AMA manual. Things to remember is that race is a social construct. And so they're not inherent biological differences. And so remember to only report on it if it's absolutely needed. And if it is needed, then list all of those represented, not just one group, and really avoid creating aggregated groups that center on whiteness as the default. Race and ethnicity should always be capitalized and used as modifiers, just like patient first or person first language. So they're not patients. They are going to be, instead of just saying Blacks, we say Black patients or patients who are Black. When reporting on sex and gender, remember that sex is the biological difference and gender is the socially constructed and enacted role in behavior, and don't use them interchangeably. So make sure to report on how that information was collected, and then report the correct variable, the one that was collected during the process of your research or the process or on your presentation. All right, next slide. This is a table just with some of the commonly used terminology to avoid and the suggested alternatives. I won't read through it, but this is a resource that we published that I'm hoping will be useful for those who are attending the presentation. And this is not the only resource you have. There's also the People First Charter and a few other tables like this in other publications. If you're ever have a question about, is this the right term? One thing, yes, I'll just limit it at that, and we can take questions later if anyone has questions. Next slide. The next really good piece of advice that I've received that I've found to be helpful throughout all the different kinds of presentations that I give is to tell a story. We all love hearing stories. Stories create empathy, and stories are engaging. And so telling a story can be pretty simple. If it's a research presentation, you can start with what the problem was. This is what we did to address the problem. This is what we found, and this is what will change as a result. I've found that the presentations that I listen to and when I coach trainees, and I'm guilty of this myself, that we're really good at doing the middle parts of the story. So this is what we did to address the problem, and this is what we found. So the methods and the results section, but the background, what the problem was, and what the conclusion, what the findings are, how people can apply those findings to their own research or their own patient care can be a little bit more challenging. And so really honing in on those two parts of the story can lift your presentation from good to excellent. And so I recommend actually working on your story before you work on the slides, before you work on your manuscript, and outline it and say, make sure you have every part of that story, and that especially the beginning and the end are the compelling parts that are going to engage your audience. Next slide. Now, I mentioned that if you tell a story, you're going to build empathy, but that's not the only way to build empathy. And so I would just remind you that leveraging empathy is going to be another key way to make your presentation compelling. If your audience can relate to the story that you're telling them, they'll be able to empathize with you, and they may begin to care even more. And I'll give you some examples of how I do this, and then later, maybe in the Q&A, you can share some examples that have been successful to you. So I think, again, this is a concept that can be applied across all different kinds of presentations. So, for example, when I am teaching the medical students about urinary tract infections, which they often find to be very boring. I used to just start by presenting the epidemiology of urinary tract infections to convey how common urinary tract infections are. And what I found is that medical students zone out the second you start presenting numbers in terms of how many millions of people suffer from UTIs, or how many millions of visits to a clinic or hospital, how many billions of dollars or resources are required to treat urinary tract infections. That's not as engaging as asking the students to think about whether or not they or a close friend or family member have experienced or suffered from a urinary tract infection ever. And sometimes I'll ask for a show of hands, as long as it's not a personal question, or as long as it's not asking them to identify themselves as, have you ever experienced a urinary tract infection? I'll say, give me a show of hands for anyone who either has had a urinary tract infection or has had a close friend or family member with a urinary tract infection. And everyone in the room will usually raise their hands. And I have found that that is one of the most effective ways to, at least to begin to leverage empathy. And they'll say, oh, wait, I really should pay attention to this lecture today, not because it's just because this is going to be on my exam in 2 weeks, but because knowing this will help me take better care of my friends, family members, patients. And so that's one example of how to leverage empathy, but I think you can do that in many other settings as well. Probably the one that can be most challenging is the really more scientific or formal scientific research presentations, where you're at a big national conference and you have 10 minutes, or you have people walking by a poster, and you really want them to care about the topic that you're presenting about and really convey why you care. And I think there can be different creative ways to do that. And maybe in the Q&A, we can hear about some of your strategies. Next slide. Now, this is what we struggle with the most, is you can create the most compelling presentation out there, but we need to, even the most engaging speaker with the most compelling presentation is probably going to lose their audience if it goes on for a long time and they don't have strategies to keep their attention. And so I think it's useful when you're working on a presentation to think about how long is the adult attention span, so that you can think about when you might need to take a break, or when you need to, when you might want to begin to incorporate strategies to gain their attention back and distract them from their device and everything else that that may be distracting them. So how long do you guys think the average adult learner's attention span is? Have I lost you guys already?
Someone said 7 minutes.
7 minutes? 25, 20. You guys are in the ballpark. 20. Yeah, you guys are about right. All right, we'll go to the next slide. So from the medical literature, which is a little bit dated, before, I think this is back before students had a laptop and a phone and, all their neighbor's laptop and phone in the lecture hall or in the conference setting. 15 to 20 minutes is the adult attention span. That's about, most people will pay attention for about 15 to 20 minutes before they begin to think about their to-do list or look to their phone because it's buzzed 14 times and they better make sure that, it's not a family emergency or something like that. So about 15 to 20 minutes. This is the direct attention span. We can bring people back, but there are creative ways to bring people back. What was really interesting to me is as I was searching this to see if this was, because this is what I was taught when I've done some medical education courses. The medical literature differs very much from the marketing and business literature, which is, this is directed at, a commercial. If you're going to be writing a commercial or an ad, this is how long you have before you lose your audience. And so the marketing data says the adult attention span is really only 8 seconds, 8.25 seconds, which is about similar to a goldfish, which I thought was a funny image. And it's gone down in the last 15 years with all of the different ways that we're easily distracted. And so just remember that it's short. It's shorter than most of us think. And so we need to be creative in ways to both engage people in the first place and then keep them engaged. Next slide. So there are many different ways to engage your audience and keep their attention. And I've grouped them into 3 different categories, which are physical, mental, and linguistic. And I'll talk about different strategies within each of those categories in the next few slides. So please move to the next slide. Physical engagement. So I think this is where we really just get people to put their device down, or even more creatively, use that device instead of using it to text or scroll through social media or online shopping is what I see a lot in the lecture hall now, is to actually use that device for the topic that you're presenting on, that you're teaching on. And so one of my favorite ways to make presentations a little bit more engaging, and I've seen this now utilized across national conferences routinely, is to do online polling. And there are many different software devices out there that are available for this. 2 that I utilize in the lecture setting or when working with trainees or at local conferences are Poll Everywhere and Socrative. Now, or Socrative, I'm not actually entirely sure how that's pronounced, but they're both really user-friendly. You can build polls and you can do multiple choice questions, you can do open-ended questions, you can include images, and there are many different ways that you can use them. And what's wonderful about them is people can answer right on their device. They can answer anonymously so that you're not, people will be more likely to answer than if you ask for a show of hands where they're afraid they're wrong. And so when I used to do show of hands, I would ask a question and would have, 10 people in a lecture hall of 100 answer because they're afraid they're wrong and that their neighbor is going to see that they're wrong. And so this way, no one is revealing their answer openly. And I think this can be used in a couple different ways. So polling, if you're giving a lecture and trying to deliver knowledge, sometimes it can be used before the content is given so that you can get a baseline knowledge, and maybe you can even skip over the intro to a topic if your audience really already has a high baseline knowledge, or you can use it at the end of presenting a section of material, maybe at that 15-20 minute mark where you're going to start to lose people's attention, and bring them back in and see how effectively did you teach that concept. Did ask a question related to the material that you just presented, and if people retained it, then you're golden, and if not, then you can go back and highlight whatever teaching point they missed. So I think this is a really effective strategy, and I highly recommend it, even in conferences, using this to, in some of the IDSA. Some of my favorite ones are the ones that are debates among friends, where you poll the audience at the beginning and at the end and see if the debate swayed the audience one way or another. These really keep the audience involved and physically engaged. So this is one excellent strategy. If you don't have the software available to you, some of these do cost money. Show of hands is actually really effective too. So again, although people might be a little nervous about raising their hands, I always start with, if you're wrong, I'm actually happy, because that means that there's a reason I'm standing in front of you today teaching you this concept or presenting on this case, because if you already knew the answers, then there would be no point in me being here. So just give people the permission to be wrong, tell them that's a good thing, and then they'll be more likely to participate. Another strategy you can do that just gets people maybe up out of their seats or physically more engaged is to ask people to do a think, pair, share. So ask them a question, ask them to talk to their neighbor about the question, and then actually have them physically participating, and you'll get them engaged and get that attention back. Next slide. If you don't have time to pause and have a real break for physical engagement, which again, if you're given a short amount of time, or if you have technology barriers, sometimes, even the best intentions, we try to use online polling, and then there's the Wi-Fi is down or the link isn't working. You can just plan mental engagement into your presentation. And so even just asking questions, even if you're not gonna stop and ask for active participation, you can pause and let the audience think about the questions. And that will just at least mentally keep them back and engaged. I think this is a really useful strategy in lecture. Again, you can use it either for baseline knowledge or to review for comprehension. In a case presentation, we coach our fellows to pause and ask either at the time of a differential or ask at the time of a challenging management question, because this really generates discussion amongst the audience and creates, again, that mental engagement. Sometimes people will just include a provocative statement, and that will engage, even if it's not requesting audience active engagement, at least it's keeping them mentally engaged. Next slide. And then linguistic engagement is useful too. We talked about inclusive and non-stigmatizing language initially, but this is another opportunity to just highlight the importance of that. If you use inclusive language in your presentation, you're more likely to engage your audience. And so when presenting, if you have some student names and want to say, when Matt or Laura, when they came up and when they took care of the patient with Staph aureus bacteremia, reminding your team about who exactly on the team took care of that patient, or even just using the inclusive you, that can bring the audience back in and remind them that they are the target audience and they're the ones who we're going to benefit from the presentation that you're giving. Humor is always useful. It's easy to find different cartoons online. One of my favorite presenters during medical school always started his presentations with a joke related to the topic. I don't know where he found all the jokes, but if you can find a joke and make people laugh either at the beginning or somewhere at the end, people get more comfortable and are more likely to engage again. I also had a lecturer during medical school who was a talented singer, songwriter, guitar player, and he would come up with songs about some of the bacteria, and he's one of the reasons I really ended up really falling in love with ID, but not everyone is that lucky. So to have that skill or to have the time to do that. So if you are musically talented and want to bring that in the right setting, that is a great way to engage your audience too. I'm not so lucky. Next slide. This is one example that I will say uses multiple different forms of the engagement strategies that I've just talked about. And I was so impressed by this strategy that my colleague and I have actually incorporated this into our medical school curriculum. And this is contagion theater. So some colleagues that I met at a microbiology education conference a few years ago shared that this is what they did with their medical students to break up the lecture time and really re-engage them. And so this uses humor, it uses physical engagement, it uses linguistic engagement. During a break or when all the students are working on cases together is how we've worked on it, but you could even interrupt the lecture. We actually have a student or another faculty member act as a patient, and then we bring the case into the lecture. So one of my favorites is we have a malaria case. So you see this woman holding a mosquito net up at the right, and we have a lecturer who will walk into the lecture hall in the middle of a lecture on parasites and say, Dr. Bares, I have a fever and I'm just not feeling well. I have a headache. Can you help me? And the students are always really confused as to what's going on. And then they start laughing and getting comfortable, and then they get to practice asking questions about the history. And it turns out the mosquito net has a big hole in it, and it's a case of malaria. But we found that this is one way to really liven up the lecture hall, and again, uses multiple strategies of engagement to retain our students' attention throughout the long micro curriculum. Next slide. Another key that can get you into trouble if you don't do it is to manage your time. So you always want to know exactly how much time you're going to have for your presentation. And you can, on average, know that it's going to take about a minute per slide. But some people take longer. Some people will talk a lot more, even with just a few words on the slide. And so really the only way to know if you're going to effectively utilize your time is to practice in advance. And the one tip that I give all of my trainees is that it's better to end early than to be rushed or run out of time, because not covering the material will, result in your learners not hearing everything they needed to hear. And then they won't hear, if you're presenting a research findings, the most important part of your story, right? That what are you going to do with these findings? How are these findings going to impact patient care or your next study? And so practice in advance and really manage that time well. Next slide. These are some basic formatting tips. I'm not an expert in this. I am, I was even, when first got invited to give this talk, I was a little hesitant because I said, if I give a talk about how to give a presentation, it kind of has to be a perfect presentation. And then you feel like you have to have perfect formatting and perfect delivery. So I will admit upfront that I'm not perfect at this, but there are a few key tips. I can tell when something's done poorly, as opposed to there's a really wide spectrum of from good to like beautiful presentations. The few key things you want to do are have a high contrast color scheme, and remember to avoid colors like red and green together on a slide, is particularly for those people who are colorblind or otherwise going to have difficulty reading your slides. Avoid overcrowding. The one thing that will, make people look at their phone, anything but your slides, is if you present a slide full of text, because they're not going to gain much from it. You're probably going to end up reading from that slide if it's overcrowded, and your audience isn't going to learn a lot from it. Stick with simple sans serif fonts. And some of the tips that I've come across are to have no smaller than 24 point, at least for a PowerPoint. Now, if you're presenting a poster, there are different rules about the size of that. That's a whole different talk, but in general, for a PowerPoint presentation, you want no smaller than 24 point text. And if you can use a picture or a figure instead of text, do. That is going to, remember, there are people who are very visual learners who are going to, you can convey, right, the old idiom, a picture is worth 1,000 words, and that is 100% true. If you can demonstrate a figure that will convey your findings, definitely recommend that over a long text. Next slide. For those of you who aren't as tech savvy or graphic design oriented, I have found that PowerPoint has a great tool now called design ideas. So if you have a slide and basic formatting in place, you can always click on the design idea, and that will often elevate your slide quite a bit. So don't be afraid to use some of the tools that are already embedded in the software that you're using. Next slide. Images, again, not just figures from your findings, those would be your first priority images. If you have a graph or another figure that conveys your findings more so than the text, absolutely use that. But if you need images for a case presentation and you don't have pictures from the patient that you took care of, there are a lot of great resources for images. I've just listed a few of them on this slide, and you can refer to this later. But there are many resources that have images that are in the public domain, and then so you can use them even if your presentation is going to be recorded and posted somewhere. You don't have to worry about copyright issues or patient confidentiality or anything like that. And so especially I would highlight the first two, or CDC resources, the CDC image library, the CDC's public health image library. You can just search for whatever either the pathogen or the disease that you are looking for, and there's many available on these resources. At the bottom, I've included this list from Stanford's medical school that has an outstanding list that's much more comprehensive than what's on this slide. Next slide. And finally, I'll end with just some public speaking tips that I think can't be overstated. The most important one that I've received that I think is really useful, it seems simple, but really useful, is to breathe. We had to remind my son about this before his piano recital a few weeks ago. Breathe and go slower than you think it needs to be, because you're going to be nervous in your head and you're going to talk faster than you did when you practice. And so just take deep breaths. Even that square breathing, breathe in for 4, hold for 4, breathe out for 4. That'll slow you down, and that'll also help with any little stage fright, any little anxiety that you have. And so breathing can't be, the benefits of breathing can't be overstated. I highly recommend deep breaths. If you're not on Zoom, or even if you are, but you have cameras on, make eye contact with the audience members. Some people get nervous looking in eyes, and so I have heard the advice to look at foreheads, which can be useful too, but you will engage your audience, you'll keep their attention if you can make eye contact and look at them. You'll also be able to tell when you're losing their interest and when you maybe need to insert one of those physical engagement strategies or some humor or something to liven up the room and bring your audience back to you. So make eye contact, be yourself, let your personality show, smile. If you look miserable up in front of the lectern, the audience is going to feel uncomfortable too. And smiling actually helps with your own endorphins and feeling of relaxing, it'll help you feel more comfortable and relaxed. So remember to smile, even if it's fake, it is useful. And then if you're in a lecture hall, sometimes coming out from behind the lectern, as long as you're still on camera, if it's being recorded, and using gestures, using your hands, that will also make you more engaging as a speaker, and that will bring your audience back in. And again, just be yourself, show that passion. I think when we convey our own passion for the topic, your audience will be interested as well. Next slide. This is the one, it's a little gimmicky, but can't be overstated, is the classic joke of how do you get to Carnegie Hall? Practice, practice, practice. If you want a stellar presentation, if you really want to elevate your presentation from good to outstanding, practice it. And don't just practice it alone. If you're a trainee or if you're working with a mentor, don't be afraid to ask for help or for a practice session, have your mentor run through the slides with you and actually watch you present. That'll give you time to practice and make sure that you're saying everything correctly. It'll also make you more comfortable so that when you're delivering the presentation, you're going to sound more polished and you're going to engage your audience more. So the benefits of practicing, you're going to be on time, can't be overstated. And last slide, I think. This is from, we as part of our ID fellowship really have realized that training is a great opportunity to work on presentations. No matter whether you stay in academia or not, presenting is a really critical skill. So whether it's just presenting informally in clinic, on the wards, or at scientific conferences, it's key to have good presentation skills. And so even if you're in a subspecialty of ID, we are going to, we present when we are consulting another specialty and we want to say, cardiology, I need an echo and here's why. So that presentation, no matter what stage of training you're at, even if you're a practiced physician for many years, we need to be able to give a good presentation. And so what are some opportunities? How is the best way to hone those? What is the best way to hone those skills during training? We've been working on that as an area of interest in our own fellowship. And so we did a survey of our faculty and our trainees, and just to try to get a sense for, are they interested in this? Do they feel they can be improved, and what feedback would be best? And so universally, everyone, all fellows felt that their presentation skills could be improved. Most of the faculty felt that their presentation skill, our fellows' presentation skills could be improved, and we're willing to provide feedback and even participate in training sessions. And when we asked what kind of feedback would be most useful, we found that the fellows actually prefer or had an equal preference for written feedback from the attending versus in-person feedback from the attending. The attending seem to prefer a little bit the written feedback versus the in-person feedback, probably just because they don't always have as much time for the in-person, although I'd argue that's just as efficient. And so the take home from this is fellowship, your training is a great opportunity. It's a great time to ask for feedback on your presentations, even if your fellowship isn't have a formal curriculum or providing it routinely. Please ask, because we faculty are always really excited at the opportunity to help mentor a trainee. And so don't be shy about asking for feedback. And if you're a faculty, please remember to give our trainees feedback, because they want this feedback and it's going to help them over the long term. And I will end with that. Next slide. Thank you all so much for participating, and I will turn it back over to our moderators for the last few minutes so we can take any questions. And feel free to put your questions into the Q&A.
Thank you, Dr. Bares, for that wonderful presentation. So we will open up the floor for any questions. You can come off mute, you can turn on your camera, you can add questions to the Q&A box, or add it directly to the chat as well. So while folks are getting situated, I can ask a question. So Dr. Bares, how do you balance keeping presentations engaging and understanding for a more broader audience that might not fully understand the intricacies of the scientific information. How do you balance that?
Yeah, I guess you're getting a little bit at, I alluded to the fact that the most challenging presentations I find are the ones that are multidisciplinary, where you're going to have audiences with expertise at different levels. And so in those situations, I think really, if you're going to presenting something a little more scientific, you can present the scientific data and then in a summary with a laid summary. So, even if you're giving the odds ratios or something a little more nuanced, and then summarized by that, this means that twice as many people got this disease than in this group than that group. And so, so sometimes I'll even say, imagine if, you had a twice, 2 times the risk of this in whatever activity they may be from. And so really just trying to take the data that you're presenting and remembering who your audience is and applying it to their daily life or their work, their field of work, or their relating it to their experience is what I've found to be useful.
That's really helpful. And thank you, Dr. Sato, for that additional comment. Colton.
Hey, thank you all so much for the talk. I really enjoyed it. I was wondering if you could talk a little bit more specifically about presenting like a poster at a conference. This ID week was actually my first poster presentation. And while I find it easier to be in like a PowerPoint setting in a lecture hall, I was kind of caught off guard by the brevity and found myself trying to explain, here's how I did all this, and then I didn't get to the results. Or so when you guys see poster presentations, what do you guys see that works really well? What are some things to keep in mind in that setting specifically?
Yeah, great question. I'm so glad you asked, because I didn't really cover anything directly related to poster presentations in this talk. And I think that's one of the most challenging types of presentations. So when working on sort of first, when you're preparing the poster, you kind of want to walk through and make sure you have plenty of visuals, because I find one of the biggest mistakes with posters is they have too much text. And you've been in a poster hall. There's no way you can read the text on every single poster. And so if you can have visuals and even, some conclusions in bold that are really clear and concise and bulleted instead of paragraph form, that's probably my first tip, just visually for posters. And then it's really good to have an elevator speech. So you want your two-liner, and then you want your longer one for people who stop by and say, can I tell you a little bit about my poster? And you rehearse it and you use your poster during that little pitch for visual cues so that you can keep your audience engaged while you're telling them about your poster. So you can say, I did this study because, this was, kind of remember that story. So this was the problem. Here's what we did about it. And then while you're presenting, really pointing out and using all the visual cues within your poster, and prepare that in advance and just have that little kind of pitch about, this is what I'm going to tell everyone who walks by about my poster. Because sometimes people will just be standing there and won't ask you a question. And I love it when somebody says, hey, can I tell you a little bit about my poster? And if they have a short spiel prepared, it's always better.
Thank you for that advice. Appreciate it.
Yeah.
Awesome question. Any other questions? Dr. Bares, what were some of the other findings from the research from the last slide? Were there any other presentation skills or any of the other findings from
Really, the biggest finding that made the biggest, or the finding that made the biggest impression on us is how willing our trainees are to receive feedback on their presentations, and how that it doesn't matter how that feedback is given, but that it really is important and valuable and makes a difference for their education. They give so many presentations, and if we never give them specific constructive feedback, then they're going to keep making the same mistakes again. And so it's just a good opportunity to provide feedback.
That's awesome. Are there any suggestions that you have in terms of um, staying up to date on things regarding your presentation content? Is there like any, staying up to date on latest developments and anything as it relates to, your presentation? Do you have any suggestions?
That's a good question. I mean, usually I think it just depends on the topic. It's good to do a quick little Google search before the day of presentation to make sure nothing has come up that's going to completely, make whatever you're presenting obsolete. But along those lines, another strategy that I found useful is bringing things back into making topics relevant to the real world. And so, for example, I'll give a talk about E. coli, and E. coli can seem kind of boring at the face of it, but I always try to bring ID in the news. And usually, when I'm giving a talk about E. coli, within the last few weeks, there will have been an outbreak somewhere that's been in the news. And so I'll say, here's why this is maybe relevant or important. And this is what was in the news today about E. coli. I think something else, just again, it's even if you're there's not something mind-blowing that's making a change in what you're presenting, just emphasizing that this is something that's relevant to today, to the real world, is useful.
That's great. Thank you. So we do have one additional question. So what is the best strategy when listeners are from different groups? Like you gave an example of experts and community workers.
Yeah, that one I'm still learning. So if anyone has advice, I'm open to it. What I have found is that, again, making sure that you're presenting data that's relevant to all the groups. So even if you have a few slides that are more relevant to the clinicians in the room, making sure that you're also presenting data that's going to be relevant to the community workers in the room. And when you're presenting the data, that's going to be at a higher, maybe not a higher level, but where it's just a little more medical and you have non-providers in the room, really breaking that down into lay terminology. I think one of the best parts about teaching first-year medical students is that it keeps me a little more grounded, and we forget as physicians how much of what we say every day is medical lingo. And so it's when I'm working with my first years where medical students where I'm reminded that words like erythema and even fever, they don't know the definition of a fever, or they don't know what erythema is. And so things that are just part of our lexicon are not part of the non-medical providers lexicon. And so remembering that and translating things into lay terminology whenever possible is useful.
Well, that's awesome. I think we're just at time. So if we have any other questions, if anyone has any other questions, we can just take them via email, and then we can send them to you, Dr. Bares.
Yeah, sounds good. I'd be happy to take questions if anyone thinks of anything, and if anyone has good suggestions or tips for, again, presenting to multidisciplinary audiences. I'm always open.
That sounds great. So yeah, thank you so much, Dr. Bares. Thank you everyone for attending today and participating in the Q&A session. Again, if you wish to revisit the webinar or share it with others, we'll have it posted to Cooper and to our YouTube channel tomorrow. So definitely subscribe to our YouTube channel. It's IDSA Foundation page. And then our next webinar is going to be on February 5th, titled Crafting Your Unique Research Pathway. I just dropped the link in the chat, and it'll also be posted on Cooper. So please make sure you register. It's going to be a really great, another great and engaging webinar. And yeah, that is all for today. We'll close it there. And thank you all again for joining. Have a wonderful day.